Communication Company Limited, located in Stuart Castle, Duncan's Trelawney, Jamaica. We broadcast on FM 96.7 locally and is heard worldwide on fitfmja.com. Our mission is to amplify diverse voices and opinions, inform, educate, entertain, and engage listeners of all ages and lifestyle while promoting responsible community development. Fit FM 96.7, your life, your music.
Destigmatize, the Western Regional Health Mental Wellness Radio Program, right here on Fit FM 96.7, every Thursday at 6 p.m. Destigmatize, to raise mental awareness and reduce stigma and discrimination through education, discussions, and highlights. Join us for lived experience interviews, to learn from the experts, for the Brainwaves Educational Focus segment, and Your Time, where you get answers to your questions. With host Dr. Lisbeth Crossman, psychiatrist. So join us every Thursday at 6 p.m. for Destigmatize on Fit FM 96.7. Brought to you by the Western Regional Health Authority, Department of Mental Wellness.
That's just what I seek. Where are you now? When darkness seems to win. Where are you now? When the world is crumbling. Oh, I hear you say, look up, child. Hey, look up, child. Hey, where are you now? When all I feel is doubt. Oh, where are you now? When I can't figure it out. Oh, I hear you say, look up, child. Hey, look up, child.
Welcome to Destigmatize, right here on Fit FM 96.7, or you may be on fitfmj.com, you may be on Facebook, you may be on Twitter. We welcome you. What a good evening, what a good day it has been, and what a good place to be on Destigmatize. I'm your host, Lisabeth Crossman. I'm the regional psychiatrist from the Western Regional Health Authority, and we're here to raise the awareness of mental health issues, how you can get help, how you can know the symptoms and can express some of the signs. But we're also here to reduce the stigmas and the discrimination, those negative thoughts and negative acts that will go against make persons who are experiencing these signs and symptoms really seek the necessary help in a time that is very prudent, and also will give them the necessary management that is needed for recovery. So we are here so we can destigmatize, take away some of those stigmas and discrimination, so that we can make this community, this world, this nation a better place. So welcome to Fit FM 96.7 Destigmatize. And we're still on the topic of depression, because we recognize that depression is really a very common topic. And we are going to be looking today at depression in what we call the postpartum period. And what do we mean by postpartum? Well, if you know about pregnancy, then it's divided into different types or different areas. And the postpartum is really after you have had or you have delivered a baby. And so we're going to be looking at the challenges that can happen in the postpartum period, that period, how it is that we can recognize these signs and symptoms, and how we can deal with any impact that can result from persons who may be suffering from any symptoms of depression during this period. We have good two guests who are going to be speaking on this topic, and please stay with us because we know that's going to be very exciting. Our first guest is going to be Dr. Janine Morris, and she is a resident in psychiatry at the University Hospital of the West Indies. And of course, she has worked here in the Department of Psychiatry in the Western region. And she's going to be speaking to us a little bit more about how we can recognize some of these signs and symptoms of postpartum depression. Welcome, Dr. Janine. Welcome.
Hello, good evening.
Good
Hi,
evening.
Dr. Crossland.
Hi.
Thank you for your welcome and thank you for having me.
I'm so
on the
glad you could
program.
join us. Yes.
I'm quite happy to be here, to share in this very important topic.
Great. And
Right.
I think perhaps Dr. Janine, we can begin to say, really, why do we think that this is a very important topic? What's some of the impact if we don't manage the depression in the postpartum period?
Yes. So the reason for its importance is because it's actually quite significant in that, the WHO has reported that 1 in 10 women a year are affected by postpartum depression.
Whoa.
And I think a lot of the time it might go unrecognized and people don't talk about it enough. And, the effects can be quite deleterious on both the mother and the baby, as well as any other people that may be within the household.
Right. So it's not only impacting on the mother and baby, but also on the family as well.
Definitely.
Yes.
And as you know, a time such as the birth of a baby, it's a happy time usually, but people don't speak about the other things that can happen. And the family unit, the mother is usually the center of the family unit. So if the mother is not doing well, then everyone in the family is going to suffer as a result.
Right.
So it's important to, speak about this topic. I don't think that we talk about it or bring it up enough. And a lot of women probably think, oh, if I go and say I'm feeling sad or down, I may be perceived as not a good mother.
Right.
I may be looked at as though I'm a weak person. So it's quite an important area of depression.
Right, Dr. Morris. So it's really the perception also that prevents mothers from really seeking the help that they need.
Yes, definitely. And that's part of, the stigma associated with mental health. Unfortunately, across the board, this is something that we are struggling with and have struggled with in mental health for many years.
Yes.
And I think education is important in trying to destigmatize these types of illnesses because it can happen to anyone.
Yes.
There's no race, no color, no creed that is exempt from developing a mental illness.
Right.
And you just never know. So we need to be aware of these things and have compassion upon each other. And, try to help where we can.
Definitely. And we want to look at some of these signs or symptoms that mothers may experience, during this time that would alert, somebody to say that something is I'm not feeling well and I really need to get some help because these are some of the signs and symptoms that I may be having. Can you guide us through those? Yes.
So oftentimes, mothers can have what we call the baby blues, which happens within the first, maybe like just after delivery, 2 to 3 days, and then up to 2 weeks.
Yes.
You can have this thing that they call the baby blues.
Right.
You feel kind of down and sad.
Yes.
You feel a little bit unsure. You're not sleeping as much because the baby's crying all the time, waking up, you're breastfeeding.
Yes.
You might not be getting the breastfeeding quite so well, especially if you're a first-time mother.
Right.
You feel some anxiety around dealing with the baby.
Yes.
How small they might be and are you hurting them, that type of thing. You may be crying a lot, feeling very overwhelmed, especially if you don't have a lot of support. And You might have some trouble sleeping, obviously, because the baby is awake most of the time.
Yes.
So these are things that are normal within the first 2 weeks.
Right.
So this is acceptable.
Right.
But
Okay.
once it goes on beyond that 2 week period, and you're getting more severe symptoms, then it becomes an issue.
Right. And when you say, so we are saying that with the baby blues, we're expecting that will go away. But if it doesn't, so if it doesn't go away, then we are into a little bit more challenge there.
Exactly. Right. Yes, that's exactly what I'm saying.
Right.
So, the first 2 weeks, because of all the hormonal changes that the woman's body is going through, all of that, the body is now trying to return to its pre-pregnancy state. So that is usually the reason for these baby blues, as we term it, which affects 80% of mothers, 4 out of 5 people. And that's fine. We accept that.
Yes.
But beyond that period now, if you find that you're having a very severely depressed mood, so you're extremely sad and you cannot get out of that mood no matter what you do. You might be crying all the time. There are implications because you may not be able to bond with baby. So, you don't even feel like holding baby. You don't want to see baby. You don't want to cuddle baby and love on baby like how normally you would. Also, you can sometimes withdraw from people. So if you're in a household with a woman and you that is postpartum and you recognize she's withdrawing, she wants to stay in her room all the time. She's not coming out to, get something to eat. She's not maintaining her personal hygiene, not bathing, not brushing her teeth, combing her hair, or getting dressed. Those are types of things that the friends and family can look at and observe. To be one of the significant symptoms. Also, you may have trouble with your appetite. So you can have it on both ends of the spectrum, where you may eat more than usual, or you may eat less than usual. Again, with the sleep, it's the same coming through from the baby blues. You may have less sleeping than you normally do, which is associated with baby as well. But you may have the opposite, where you may want to sleep all the time. You just have no energy. You feel very, very, very tired. No energy whatsoever. Mothers can also have a decreased interest in activities that they normally used to like. So if, for instance, you're interested in gardening, you no longer want to go out and water your flowers. If you like to watch a particular show on television, you don't even care that a new season came out. You're not interested whatsoever. You can also have feelings of anger and irritability. Some women may feel hopeless. They may feel worthless. They may even have feelings of guilt or shame. You can be restless. You can have a diminished ability to concentrate. So, for instance, you may be watching the news and you're not following what's happening. And the most significant is thoughts of wanting to harm yourself, or recurrent thoughts of death, or even thoughts of wanting to harm the baby.
Wow.
So these are quite significant things. And you have to look out for them. And if you're in a household with someone who's just had a baby, be on the alert for these things. Beyond that initial 2-week period when baby is there.
So Dr. Morris, we're saying that with the blues, you're not going to get the severity to the extent that we're seeing it in persons who are having no depression. This is now depression. You're now into postpartum depression.
Exactly. So you've now crossed over from the blues into depression.
And we are saying that this is going now more than 2 weeks.
More than 2 weeks.
More than 2 weeks, right?
But more than 2 weeks beyond the birth of the baby.
Right. And do we get concerned? Let's say if mother just had baby, but I guess she's having so many challenges. Probably, father's not around, nobody to help her with the other children, financial woes, and she now start having thoughts of wanting to harm self and harm baby. And it's not up to 2 weeks. Do we get concerned about that?
Yes. These are definitely concerning things because this is a time that mother needs a lot of support.
Right.
In order to be able to function optimally as a new mother, you need a lot of support.
Right.
So this is the time when, there's that African proverb that says it takes a village to raise a child. So that's the time when now auntie from down the road has to come and help. Cousin has to pitch in. Friends, family to support this woman through this challenging time. And of course, it's a lot of the times when women are experiencing these episodes, they will tell you that they themselves didn't even have the energy to go and seek help. It is one of their relatives that said, no, man, you really need to go and see somebody because this is not good. You're staying in the room all the time. You're just crying all the time.
Wow.
So it's really the support system that is so vital after the birth of a baby. So yes, it's very important for support to be in place. And even before the baby is born, I think, things need the same way how you would have a baby shower and everybody gives you all these gifts and everything. Your friends need to kind of pitch in as well when it comes to, okay, baby's born. All right, I will come and stay with baby for 2 hours and let you go and sleep.
Almost like a timetable. Almost like a timetable, a roster. Yes.
Yes, exactly. Exactly.
That's almost a very good point. Yes. I don't think we have thought about it like that at all,
Right.
But perhaps, as you say, if the support is going to be there, you need the support right around that time so mommy can get some rest and reduce her risk of postpartum depression.
Definitely.
But I wanted to ask you, go ahead. You wanted to say something.
I was going to say that, and even touching on this topic further to the postpartum depression.
Yes.
Mothers can also develop something which is also of significant concern, which is postpartum psychosis.
Wow.
Which is another thing that we don't really talk much about. But, there's one case that will always stand out in my mind of a lady who was very, very, very ill, she had her baby, became depressed. And then went on to develop postpartum psychosis. And she was actually hearing voices telling her to throw her baby in the river. And, she literally walked down to the side of the river and had this infant there in her hands to throw the baby in the river. It's just that, somebody was passing by and was able to stop her from doing that. And that always stands out in my, I think that's when the buck dropped for me that this is something that is so significant because infants can be, killed as a result of it.
Right.
So it's not just, mommy feels a bit sad, give her 2 pills and let her feel better, or take her out and let her feel better. It's a very significant thing. So we need to pay attention to mothers in this period.
And
I also find that a lot of the time, sometimes mothers don't get the support that they need, similarly to what you were saying before. Because people think, you just had a baby. Look how sweet this baby is. He's, gorgeous baby. Why aren't you happy? And they don't understand, that it is a medical condition.
Right. And I want to add that when you start hearing the voices, that's not an emergency. That's something that we don't. Yes.
Definitely. It is an emergency, which requires emergent care because, as I mentioned, mother can harm herself or mother can harm baby as well.
Right. And sometimes it happens in a split of a second. So it's not something to wait around and watch, So we need to encourage our listeners, if you know persons who may be going through some of these challenges, then it is not a time to sit and watch at all. I wanted to look, though, Dr. Janine, at are there any risk factors, some things that will push persons even more into the realm of postpartum depression that persons need to be aware of. And so if we can mitigate some of these factors, then we can have a more successful delivery and even postpartum period for the mommy, and even better for the child as well.
Right. Yes. So definitely there are some risk factors that you can look at. So if this woman who has just delivered the baby has had depression in the past, that is also a significant risk factor.
Okay.
So, you would have to be aware of your medical history and pay close attention to it.
Right.
Because if you have had depression in the past, you would be at risk for developing postpartum depression. That's just one of the things because of the genetic association and how the genetics work with mood disorders. So that is another thing that you have to be aware of. If you've ever had depression in the past,
yes,
and you've just had a baby, you need to be on the alert and look out for that.
Okay.
As well as not only depression, but bipolar disorder. I'm not sure if in this segment in your previous segments on this radio program, you've spoken about bipolar disorder.
No, we haven't gone there as yet. Yes.
Not yet. Okay. So I won't go too deep into it then. But if you've had a history of something called bipolar disorder, then that's another risk factor for postpartum depression.
Right. And probably just to say to persons that these are periods where persons may experience depression, and or what we call mania high, or the highs and the lows, and that's why we call it bipolar, because it has two poles. So we will get into that in future sessions rather, right? We'll go ahead, Dr. Morris. Yes.
Yes. Right. So I'm just speaking about the history part of it.
Definitely.
If you've had a history of depression yourself, then you're high risk. If you've had bipolar disorder, then you're high risk.
Right.
If you've had postpartum depression in the past, then that's also another risk to look at.
Okay.
Because if it's happened before, it's likely to happen again. Also, if you've had family members who have had depression in the past, which is another reason why I think we need to talk to each other a bit more and say, well, this happened to me or that happened to me, so that again you can make others aware and it can assist with destigmatizing these things.
Definitely.
Also, if you've had very, very high stress levels, like within the past year or during your pregnancy, any pregnancy complications. So, if there were any abnormalities within your pregnancy, those are things that can also increase the risk. Also, if you've had multiple babies in the delivery, so if you've had twins or triplets, that can also increase the risk.
Okay. What
and
about
also,
age?
Right. Age can be something as well. Because usually it tends to happen more in younger women.
Interesting.
So that's another consideration that you need to take into account. And again, any other social types of problems. So any discord in the household with your spouse, or having a weak support system, any financial difficulties at the time.
Right.
Those are things that can also predispose you.
I get you. Yes.
To having postpartum depression.
Okay. And if you were to, perhaps somebody saying, so what kind of help do I seek for, I'm having the symptoms. What kind of help do I seek? Well, how would you advise them?
Right. So in terms of the treatment or management of the postpartum depression, there are kind of two approaches. One is with the use of therapy, which is what we call psychotherapy. And then one is with the use of medication or pharmacotherapy. So there's psychotherapy and there's pharmacotherapy. So first of all, of course, you will need to be assessed by a medical doctor.
Yes.
So once you've been having these symptoms, you will go into usually it's at the well baby visits that a lot of these things are picked up. And then either the pediatricians or the OBGYNs make the referrals over to the psychiatry department, or they can send you over to your GP.
Remember, we also have Dr. Morris, in the clinics,
they will assess you completely.
Right, in the clinics, we have also our midwives, and our family nurse practitioners. So most persons may not end up at a pediatrician or OBGYN, but they can. And I know that they will do some screening for postpartum depression on the mothers that will come back for taking the well baby clinic, for the well baby clinic. Yeah.
Yes, definitely. I know that they do that screening for sure. To just check in on mothers, which is great. It's an awesome initiative because it can help to capture the people who are more at risk at an earlier time and initiate treatment earlier. And of course, once you treat earlier, there are better outcomes for the patient.
Definitely.
So that definitely is a good initiative. So once you are assessed, or once patients are assessed, then the decision will be made about treatment depending on the severity. Usually, they are assessed in terms of severity by a screening tool. I won't go too deep into this because this is for a general audience. But there's a screening tool which tells you, okay, if your score is between a certain range, then you're high risk, or you're medium risk, or you're low risk. And then the treatment is guided based on where you are in terms of low, medium, high. So if you're in the low risk category, usually you can get just what we call the talk therapy or the psychotherapy. So you'll usually be referred to a psychologist who will speak with you and give you some coping strategies, determine how you cope, and can help you to adjust your behaviors and your thoughts to make your outcomes better. And then, of course, if it is moderate to severe, then you more than likely will have both the talk therapy and medication. Now, medication is an iffy thing because a lot of women are concerned with the breastfeeding aspect of it. Like, doctor, will this affect my baby? And of course, there's a possibility that can happen. But you have to weigh the risk versus the benefits. So if this is a mother that is not functioning whatsoever, she's not caring for baby, she's not caring for herself, all she's doing is crying, staying in her room, she's not eating, she's not sleeping, this is somebody who will benefit from medication and psychotherapy. And baby can be given formula. There are many formulas that are very good and can substitute. I mean, there's nothing as good as breast milk. Don't get me wrong on that. But there can be substitutes during the period so that we can get mommy functioning, because a happy mommy makes for a happy baby. That's exactly what our aim is during that period.
So
that's the main aim.
Dr. Morris, you have gone through the reasons for us to be really speaking about depression in the postpartum period and after the delivery of the baby. You have looked at the signs and the symptoms of depression and what we need to look for. You have also looked at some risk factors and also given us some tips as to how it is that we are going to be managing patients or clients who will present with some of these signs and symptoms. I want to thank you for coming on the program Destigmatize, because I'm hoping that we'll be able to raise the awareness, because as you said, and rightly so, that a happy mommy equals a happy baby. And we want to, if we are able to intervene early, then we are going to be having all of those happy mommies presenting with happy babies. And we know the positives for the future. So we want to thank you so much for coming on Destigmatize, Dr. Janine Morris, resident at the University of the West Indies, Hospital of the West Indies, and also our resident here in the Western region. You know, we own you, Dr. Janine. And we're looking forward to you coming back to us in the West. But so thank you so much. You hear the yes? I resounded yes.
I'm definitely looking forward to that. Believe me.
Okay. Thank you so much for being on Destigmatize.
You're very welcome. And I wish you all the best for the rest of the evening.
The same to you. Thank you.
Okay, then. Thanks.
And who can say if your love grows as your heart shows? Only time.
Welcome again to Destigmatize Fit FM 96.7, or you may be on fitfmja.com, you may be on Facebook, or you may be on Twitter. And we're speaking about depression in the postpartum period. We just heard from Dr. Janine Morris, who spoke to us on really what the impact of depression in the postpartum period, how it affects mommy and how it can impact on the young baby. And also she looked at some of the common signs and symptoms that women may experience during this period, whether there may be changes in your sleep, changes in your eating pattern, changes in your concentration or your energy levels. You may also have thoughts of wanting to harm self and harm baby, and that is can be very devastating. We want to thank you for staying with us because we're going to go on. And I want to introduce to you Professor Wendell Abel. And Professor Wendell Abel is no stranger to the West. We own him, we claim him. He's a former head of psychiatry of the Western Regional Health Authority, but he's also former head of community health and psychiatry at the University of the West Indies and a renowned consultant psychiatrist. Welcome, Professor Abel.
Hi, good evening, Dr. Crossman. How are you doing?
I am good, thank you. Welcome to Destigmatize on Fit FM 96.7. And we're speaking about postpartum depression. And we're hoping that you will be able to speak with us. Seems as if we have lost Professor Abel.
No, I'm here.
Oh, you're here. Okay, so we're just getting another beep. So,
did you introduce me as head of community health and psychiatry at UWI?
Former head.
Former.
Yes.
And I'm proud to tell you that
yes.
the son of Trelawney is now the head, Dr. Kenneth James.
Oh, nice to know. Nice to know. So we have some Westernites.
And I think his mother has been a long-standing and very lustrous educator in the parish of Trelawney. So Trelawney should be proud. They're sending their people to great heights.
Okay. His mother was from Granville?
I'm not certain.
You're not certain. All right, we'll find out. And I'm sure you'll find out.
Are from Trelawney, so his mother may be listening to you.
Okay, sir. Well, welcome, sir. Well, we're speaking about postpartum depression, and I know you have a wealth of information for us because we are trying to see how we can raise the mental health awareness, decrease stigma and discrimination, allow persons who are having the signs and symptoms to speak out some more, to get the help that they need in a very early intervening time, so that we can prevent any of the impact of depression, both on not only on mother and child, but also on communities and families, and of course, our country. So tell us, Professor Abel, in terms of postpartum depression and your experience and how it impacts on the lives of individuals.
Well, first of all, when we talk about postpartum depression,
yes,
we're talking about depression that occurs usually after a lady has had her baby. Yes?
Yes, sir.
And mark you, women can get depression when they're pregnant and so on, but the postpartum is usually after you give birth to the child.
Yes.
Right? Although the depression can start earlier.
Right.
And so part of it, we have to discuss what are the signs, how you know when somebody's depressed.
Mm-hmm.
And people may ask them why women will get depression after they get pregnant.
Mm-hmm.
Yes?
Mm-hmm.
But firstly, I want to just and remind us that depression is very common in women,
Right. Yes.
1 in 5 female,
Mm-hmm.
1 in 5 um, um, females, if you walking around, if you count 1, 2, 3, 4, 5,
Yes,
chances
sir.
are one of them will get depressed over a
Right.
lifetime.
Right.
Yes?
Right.
And so it's common and very common in women. And one of the reasons why it's so common too is because the hormones that the body produces in
Mm-hmm.
women, yes,
Yes.
can cause depression. That's why some women get depressed around the period, some get depressed when
Right.
they're pregnant, some get depressed after the birth of the child,
Yes.
some get
Menopausal.
depressed around menopause. But I
Yes.
know we're talking about postpartum,
That's right,
after
sir.
the birth of a child.
Yes.
So the hormonal changes that occur can cause the mother to be depressed.
Yes.
And in fact, every time I think and talk about it, I reflect on the fact that my mother,
Mm-hmm.
my own mother,
Right.
suffered from. I don't want to even use suffer. She experienced postpartum depression.
Right.
Yes,
Yes.
and
We call it the lived
she
experience.
would have this depression after the birth of some of her children, and so it happened that when I was born, my
Yes.
mother became very depressed.
Okay.
You know,
Yes.
and um, I'm 61. Two this year, so
Yeah.
62 years ago. And
Yes.
people never understand these things fully. But
Okay.
what would happen is that
Yes.
she feels sad and depressed.
Mm-hmm.
Yes?
Yes.
She don't have no energy.
Right.
So she can't come out of bed. She take bed. Yes?
Yes. Yes.
Right. And not eating.
Right. Right.
Yes?
Yes.
Food. She just don't have no desire for food. Now, remember the mother has to be breastfeeding. So it's
Yes.
important that
You're
she
sounding very low,
take care of
Professor Abel.
herself.
Professor Abel, you're sounding very
Yes.
low. You can.
And what?
You're very low. Increase the volume, please.
All right, just that's it.
Yes. Right. So we are speaking with Professor Wendell Abel.
Yeah, is it better?
You're much better, sir. Thank you.
Mm-hmm.
Yes, continue. You
I
were
was
speaking
saying,
about some of the symptoms that your mother or signs that she may
right,
have
yes.
shown. Yes.
So she don't have no energy.
Yes.
Then cause she don't have no motivation and drive, she can't take care of the baby, so she couldn't
Wow.
fully attend to me, wasn't breastfeeding me.
Yes.
And sleep is a big thing that is affected in depression. So she had difficulty falling asleep.
Yes.
And then when she fall asleep, she finds she wake up 1 o'clock in the morning.
Yes.
Early
Yes.
morning. That is such a typical feature of depression.
Right. Right.
And another thing, what happens to people when they're depressed is that they're miserable, irritable. In Jamaica, we say they're miserable,
Yes.
ignorant,
Yes.
irritable.
Yes.
So can you imagine a lady who is depressed
Yes.
and the baby start crying in the middle of the night?
Yes.
Yes?
Yes.
It's just annoying, yes?
Yes.
And because of that, some women, when they're going through the postpartum
Yes.
depression,
Mm-hmm.
because they don't have the energy, they
Mm-hmm.
take to bed,
Yes.
right? They're not sleeping well.
Mm-hmm.
They don't have no desire for food.
Mm-hmm.
They're not taking care of themselves and the baby. They neglect the child.
Yes. Yes. Yes.
And also, so they will have the baby there all day and a breastfeeding
Wow.
the baby.
Yes.
Now, my mother didn't do that.
Right.
That never happened to me because my grandmother realized what was happening.
Ah.
My grandmother took me away and ensured that I had proper care, and that my
Mm-hmm.
mother also got proper care.
Okay.
But
Okay.
some women with the depression, they get irritable, and
Mm-hmm.
sometimes they get cross, and then we hurt the baby.
Yes. Yes.
In fact, one woman I remember had postpartum depression, and she tell me that when the baby wake up at night time and I cry, it irritate her, and she just pick up the baby and just shake the baby.
Mm-hmm.
Yes,
Yes.
and in some cases, they actually hurt the baby.
Yes.
Women have been known to even kill their baby
Mm-hmm. Yes.
with the
Mm-hmm.
postpartum
Some
depression, and
depression.
sometimes they start even hear voices.
Yes.
Yes,
Yes.
and think people want to hurt them or even demon a cry through the baby and that sort of
Right.
thing. Then that's what we
Right.
call, psychosis. That's a little bit more severe, right?
Yes.
But the
Yes.
point is, these things can happen to a woman who is pregnant. Now, in our culture, when we see things like this,
Mm-hmm.
the first thing that comes to people is demon possession,
Mm-hmm.
right? And
Yes.
so, and the big one is that dopey,
Yes.
right?
Yes.
Somebody blow them, put pan them, and then
Mm-hmm.
turn hand pan them, dopey.
Yes.
And
Yes.
in fact, I remember growing up in my community, and a lady actually had postpartum depression,
Mm-hmm.
and wouldn't be eating. And I remember I heard some ladies laughing and say every time she pick up the food, the dopey just backs the food out her mouth.
Mm-hmm. Mm-hmm.
Yes? And
Mm-hmm.
so when people believe these things,
Yes.
they know
Yes.
then go to the church, the elder, the minister first.
Mm-hmm.
Or some of them go prayer meeting and they pray and that sort of thing.
Mm-hmm.
Yes?
Yes.
And some people may even take them up into the Trelawney Hills, right, to go see somebody up in Albert Town or Stuart Town or wherever.
We're
Yes?
not so sure
To go
about
see.
those places, Professor Abel, but if you say so.
What's that?
We're not so
I
sure
hope
about
the
those
people up there don't get
places.
vexed with me.
Yes.
But
Yeah.
remember, me used to work in that Trelawney, so me know
You
things.
don't work anymore, sir. But anyway, you're,
But
you're speaking about the pathways to care. And we're
the
saying, and
pathway to
I
care,
agree with you that a lot of
Dr.
persons,
Crossman, that's how the psychiatrists call it pathways to care.
yes,
Yes?
sir.
How
Yes.
people see care. And we have to understand this,
Yes.
because that's how the thing set up.
Yes.
And unfortunately,
Yeah.
and I'm not saying, I'm not, we have to respect people belief system or people believe, yes?
True. True.
Just like some weeks ago, somebody went to a mother,
Mm-hmm.
and when mother saw the person, mother said, "This bigger than me."
Mm.
Take the person to go see Dr. Krasman or Dr. Abel. This
Mm.
one bigger than me,
Mm-hmm.
right?
Mm-hmm. Mm-hmm.
And I hope a lot of our church people, our elders, spiritual people working with the community, traditional healers,
Mm-hmm.
and a lot of them listen to our program sometimes,
Yes.
and they're wise enough
Mm-hmm.
to be able to pick up some of these things. That's why we're having these discussions, right?
Definitely, sir.
So they can tell people to go see, take the
Mm-hmm.
person to the health center, to
Mm-hmm.
Dr. Krasman,
Mm-hmm.
so that they can get treatment.
Mm-hmm.
And who also see a lot of women with postpartum depression are the midwives
Yes,
and the
definitely.
public health nurses. And they
Yes,
are trained, they're
definitely.
exposed to pick up these things in clinic. And
Yes.
how could I forget our good community health aides, the
Mm-hmm.
people they call the blue frock nurses,
Definitely.
right?
Definitely.
They're very important in the healthcare system. In
Yes.
fact, we said they are the gatekeepers.
Mm-hmm.
Sometimes they are the first person who make contact
Mm-hmm.
with people in the community.
Mm-hmm.
Yes?
Yes,
Them
definitely.
see the lady not turn up a clinic,
Mm-hmm.
right? Say a check up,
Mm-hmm.
and they go down to her yard, go knock, because they say, this lady is usually a good lady when she have all her other children.
Yes.
Carry them come clinic. Oh, she
Yes.
not come with the baby.
Yes.
The nurse
Yes.
check up the baby. It's what we call a 6-week clinic.
Yeah. Well, they have
Yes?
early and then 6 week. Yes.
That's right, the early
Mm-hmm.
and then the 6 week. And you find
Yes.
out the lady not just have no interest,
Mm-hmm.
carrying the baby if you go clinic.
Mm-hmm.
I know bad the lady, bad and I don't care, that
Mm-hmm.
she slight, right?
Yes.
She may very well be having postpartum depression.
Yes.
And then these community health aides would go and visit
Mm-hmm.
and encourage her to come out and talk to the family.
Mm-hmm.
And so it's so important for us.
So it speaks to the support, Professor Abel.
Yes?
It speaks to the support in community. And
Absolutely.
yes.
Support community.
Yes.
And sometimes we make all of these things worse too for the women.
Mm-hmm.
Sometimes when some of them have babies, the men disappear.
Mm-hmm.
Yes?
Yes.
And that push them deeper into the depression because
Right.
they realize there's nobody around
Right.
to support them,
Right.
to help them, right?
Right.
Man
Right.
who father this child that suddenly disappear, right?
Right. Yes.
And it's the other family members,
Mm-hmm.
Mama, Granny,
Mm-hmm.
right? And the aunties and the sisters in the yard
Mm-hmm.
and live on family land, right?
Yes.
Who have to rely on to look out, yes?
Mm-hmm.
When right?
Yes.
Recognize that something may be wrong. Could be depression. And the good thing about depression is that it's treatable.
Exactly. Yes.
It can be treated.
Yes, sir.
Yes.
Yes.
And there are many ways we approach treatment. Yes. And that's why
Yes.
it's so important for them to see a qualified healthcare professional,
Yes.
like a psychiatrist. Yes.
Yes.
Because depression is treatable.
Right.
Many instances we may, not all the time, but in very severe cases we may have to give them medication, right? But that's a decision that the doctors make, right? Because people may think that we like to give everybody medication. It's not true, you know, right? We do it on a case by case basis. Only when we need to give medication, we give medication, especially the lady has to breastfeed.
Right, right.
Yeah, so it's very important that we seek help, but it's important for us to go to somebody who's well-trained.
Yes.
So when somebody has postpartum depression, they need to go see a doctor. This is not a situation where the psychologist can help them. Now, they should not be the frontline person. It's bigger than psychologists, right?
Yes.
They need to go to the psychiatrist or to the general family doctor. They're properly evaluated, and then if the psychiatrist or the family doctor think the person needs to get some therapy, then they'll be referred, right? Because a lot of times people are like, go to the psychiatrist first.
True, and that's why. Yeah, and I want us to remember our nurse practitioners too.
And our nurse practitioners.
Yes,
absolutely.
Definitely.
Can I forget our nurse practitioners?
Yes.
Because they're highly trained. They have some well-trained nurse practitioners.
Excellent ones too, sir. Yes.
You know?
Yes.
And in fact, I take your opportunity and your program to big up Miley McCallum, who was a stalwart in mental health in the parish, yes?
Of Trelawney, yes. And in the Western region.
She was the best, and she was from the West, yes? So we big up Miley. I know our friend them went call her and so she hears that we are bigger up on Dr. Crosman and Dr. Abel, bigger up on the program.
Definitely.
But Miley, we just want to recognize the great work you have done, because you have visited many homes and picked up many women with postpartum depression and bring them in for treatment and nurse them and get them well, you know? So,
and it's a good thing to big up Professor Abel, because we should big up all our frontline workers and all our healthcare workers, because they have been really doing a marvelous job under the resources that we have, the diminishing resources.
And, Dr. Crosman, Mr. Spencer would be vexed with me too, because I used to work with him, and he's another stalwart from
mental health. Yes. I know. So just be general and say all health workers, and if you want to say mental health
workers,
yes, sir.
Especially all of those who have sacrificed so much during the pandemic.
Yes.
You know, the pandemic has really been stressful to our health.
And if we look at the
from Trelawney.
And if we look at the pandemic too, and how it has impacted on our mothers, and especially those who may have recently delivered, because we're thinking about the financial woes, and we're going back to school shortly, and all of the challenges that will come. What are some tips that you'll give for persons who may be?
And I'm glad you touched on that, because every time during the pandemic, I started to talk to people. I would ask the women, how you doing? Everybody say overwhelmed.
Oh, yes.
Because the women have, can you imagine you just had a baby, you have to take care of the baby.
You
have 3 or 4 other children.
Yes.
You have to at work, and help them with them maths.
Yes.
Right? And then worse, now you have your own mother.
Yes.
Right?
Yes.
Who not too well.
Yes.
Blood pressure, you have to go visit her from time to time. And your grand auntie who live over wherever. Right? So women have really had to carry an enormous burden during the pandemic. And we want to again pause to big up all the women and the mothers in Trelawney who have done a fantastic job. Wherever you are this afternoon, give yourself a big clap. Big up yourself. Yes? Everybody.
Yes?
Professor
Abel might get in trouble, because we're also worldwide, because we're on YouTube and Facebook and Twitter and
What's that?
We're international, sir. We're on Facebook, we're on YouTube, we're on all sorts of the social media platforms.
Because you broadcast
yes.
And wide.
We're far and wide, yes.
Everything starts from Trelawney and it just spread out all over the place, right?
Yes, sir.
Worldwide, global,
Yes, sir.
to the world.
Yes, Trelawney, to the world.
To the world.
To the world. But what are some
But you know,
tips that?
Trelawney is a
Yes,
to the world parish, you know,
it
because that's
is.
where Usain Bolt is from.
Yes, sir. We know very well.
Yeah,
Yeah.
back to you. And so you were saying
Yes.
um, tips that
Yes,
we
for
should.
prevention, because if we can prevent, it means that we are
You mean in
able
terms of what? Just depression generally,
in
or
especially for women who are now pregnant and are thinking about all the challenges that are
well, you know,
ahead.
one of the first thing is that
Yes.
once you're pregnant, you know, you should go to the health center or
Mm-hmm.
hospital and get
Definitely.
yourself booked, right?
Yes.
Into a clinic because
Yes.
your follow up during pregnancy and after pregnancy is very important, right?
Extremely. Mm-hmm.
Because they're able to pick up any problems you may have, high blood pressure,
Mm-hmm.
diabetes, and even depression,
Mm-hmm.
right?
Definitely.
And one thing we have to remind people is depression is like any other illness.
Yes,
It
sir.
doesn't affect the brain,
Mm-hmm.
just like how high blood pressure affect other organs. Yes,
Right. Yes.
so it's very important that you book into your clinic, see a doctor, and keep your appointments on a regular basis. It's also important for people to pay attention to their diet,
Mm-hmm.
right? Generally in life, watch what you're eating,
Mm-hmm.
cut down on the whole heap of starch and the salt food, you know, and women who are pregnant, especially if they have high blood pressure, they have to watch those.
You're very low, Dr. Abe. You have to speak up. You're going low.
Yes, that's the women who are pregnant with all of these issues, they must watch their diet
Yes.
and so on. Exercise is important. All of us should be exercising, but we know also women when they're pregnant, they have to. It's good to do your exercise, but
Mm-hmm.
I mean, follow the advice of your healthcare providers to how
Mm-hmm.
much and what type of exercise you do, right? But all of us need to maintain some level of exercise. In fact, exercise is one of the most powerful antidepressants to help
Yes.
people.
Yes.
Yes, not true,
Yes.
doctor. Go
Yes,
ahead. What?
sir. Yes, sir.
Yes, exercise good. And another thing I find too, you know,
Yes.
sometimes people find they get anxious. Yes,
Okay. Yes.
pregnancy or just
Yeah.
generally in life, and some
Yes.
people even get panic attack.
Yes.
What I find work for that is deep breathing
Oh,
exercise. Yes,
yes. Yes.
you have to run if you're suffering from anxiety and want the doctor test you and make sure so you're safe. You know, if you run go emergency room every time you get little panic attack, right?
Mm-hmm. Mm-hmm.
Practice deep breathing exercise and
Right.
find how that can help to manage it, right?
Yes. Yes.
And it's so important for us to live good with people.
Yes.
Live good with people
Yes, sir.
and have good friends around you and network, right?
Mm-hmm.
You keep in touch with your family, your friends, and
Mm-hmm.
even members of your faith community, your church, if you go
Yes.
church, right?
Yes.
What we find is that people who are socially connected,
Yes.
right, who have good friends,
Yes.
yes,
Yes.
and not friends to sit down and chat people business and tear down people, but friends that you can rely on to share
Definitely.
and to give you console and so on. It's
Yes.
important for us to have good social network who can be very supportive. Yes,
Definitely.
a mother who may be pregnant and she has to go to clinic or health center, she can call leave her baby with a friend,
Mm-hmm.
trusted friend
Yes.
who will look after the baby, make sure that the child gets food and make sure nobody in the yard not interfere with the child,
Mm-hmm.
right? Sexually or otherwise. These things are
Yes.
very important. So we have to
Yes.
make sure we have good, supportive network,
Yes.
friendships. Yes.
Yes. Yes, sir.
Um, and another important thing is for us to, all of us, to look out for some of the signs that
Mm-hmm.
we talked about. Sign that you're not sleeping well. You
Yes.
find your appetite gone. You find you feeling down and depressed,
Mm-hmm.
and you're getting a lot of negative thoughts and so on.
Mm-hmm.
It may be a signal that something is wrong.
Yes.
And what you should do is seek help early.
Mm-hmm.
Do not be afraid to go and seek mental health
Mm-hmm.
care,
Definitely.
right?
Yes, sir.
There can be no good health
Without
without good
mental health.
mental health.
Mm-hmm.
And so I encourage people to seek mental health care because if you have depression, you know, it doesn't mean that you're broken, you know. Yeah?
Yes, sir.
And what you have to remember is that depression, condition like depression, can be treated. And the earlier you get treatment, is the better
Better
it
the
is.
recovery.
So don't be
Yes.
afraid and embarrassed to go and get help. Yes?
Yes.
Um,
Yes.
so I just encourage people to go and seek help. Yes? And
Yes.
then, there are many other good things that we can do to just maintain wellness.
Yes, sir.
Yes, if you are a good Christian, and if you're not a good Christian, even if you're not a good Christian, make sure you pray. Prayer is very good in many people's life. If that's what you believe in, yes?
Yes.
And there are lots of, techniques that we're using now called mindfulness technique, which people have been using for many years,
Years.
yes? Whatever works for you, you use them. The deep breathing, the exercise, finding some time to go out go out and do outdoor activities, especially
Yes.
with the children and family in Trelawney. I don't have to tell the Trelawney people about this, right? But other places all over the world, you're going passing through Trelawney, you see people by the beach,
River.
every day, any time of the day, and people in Trelawney know how to do this sort of thing. So I encourage people all over, right?
Yes, sir.
Engage in outdoor activities. These are things that are helpful and good for us, right?
Yes.
And
Yes.
always have a trusted person that you can share things with, somebody you can confide with and confide in, and sit down and talk and that sort of thing.
Professor Abel, I am so glad that you are a part of Destigmatize this evening. You have given us some wonderful tips. You have gone through the lived experience of your personal experience of what happened with in your time. And I believe that if that has resonated with somebody who may be going through those symptoms, or you may have a neighbor, or a friend, or a family member, then it means that help is available and you need to seek help, or health centers, or your general practitioners, your psychiatrists. You need to seek help now. And you have also given us the tips about our social connections, our supportive network, having the skills in terms of increasing our exercise and our healthy food eating habits, looking for symptoms and seeking help early. A lot of tips that you gave us, and I do hope that through these experiences we will be able to recognize early, to intervene early, and recovery is always necessary, and the way to go to ensuring that persons are their best selves. I want to thank you for being a part of Destigmatize, Professor Abel, looking at depression in the postpartum period. We really appreciate your coming and your giving your expertise on this topic. And we look forward to having you, I'm sure, at an early time to speak more about raising mental awareness as we see to destigmatize right here on Fit FM 96.7. We're also on fitfmja.com, on our YouTube channel, on our Facebook channel, yes, and we're on Friends Who Love Fit FM. Yes, I forgot that one. So Friends Who Love Fit FM. Thank you, my brothers and sisters, for joining us. We really appreciate your staying with us with depression in the postpartum period. We are here. We are back here next week, Thursday at 6 p.m. With our engineer, Mrs. Julia Benayo. And we want to say there's no good health. We're following Dr. Professor Abel. There's no good health without good mental health. And of course, but for the grace of God go I. And to close us out, my favorite, Rondell Positive, The Mirror. And we're going to say bye now. But remember, Destigmatize next week, 6 p.m. Thank you, everybody.
Oh, yeah. Answers in the mirror. The mirror. In the mirror. Oh, yeah. Say the answers in the mirror. The mirror. In the mirror. Oh, yeah. Are we living in a selfish world with self-centered men, women, boys and girls? Caught in self-pity, seeking self-justice. Every human come subscribe to this. Let's choose to help others, don't be self-serving. Better to give than receive, it's more rewarding. Born to lead in an area of gifting.